Augustin Bahati from Rwanda. He is a person who hasn't yet been to the United States, but he's been working on the front lines with the church there, which is one of our projects of distribution, and with the inclusive mission for hope and health that he has started there in Rwanda, with a particular focus on LGBTQ persons. So welcome. It's good to see your face.
Augustine, I'm sorry. You're gonna have to unmute yourself. I can't do that for you. And good. Can you start over again?
So
sorry.
Okay, sorry. Thank you. I thank you very much for allowing me to participate in this Zoom meeting, and I thank also those who have organized this meeting, so as we can share to you what happened concerning the distribution of the food and so on and so on. So thank you very much, and thank you for those who are just participating in this meeting. And I really thank the Center for Health Center for Health. That's why I would like to present to you my presentation on showing you how we have just worked with the fund we received. I really take this opportunity to thank the Center for Health and Hope and donors for the support that was available to intervene in suffering of starvation linked to confinement, and then of the population to prevent the spread of the pandemic, which could just make a disaster and up to today. Next. So in the fund which we received, we have supported with the food, with the food to the beneficiaries, and we supported with the mask to those the staff who distributed the food. Next. Next. Yeah. So I would like just to show you why this support was very needed, and the target group and the target person where the food reached, on which person the food arrived, and how the fund and at which level we have used the fund. Just as we know, due to the lockdown related to COVID, vulnerable families suffered with hunger everywhere in Rwanda. It was very dangerous. And the first wired fund was directed to EMC Rwanda Provisional Conference, clergies, which would just support the members of the church. But this report will be presented by Reverend Makawaria. And the second wired fund was directed to 26 families who are primarily the beneficiaries and partners of Center for Health. We have there the 14 families who were supported by Center for Health and Hope in buying for them health insurance. And also we have also 12 families who are the founder of Inclusive Mission on the Health for Health and Hope. So since the families were many suffering from the lack of food, we have collaborated with local authorities, and then we decided that we can distribute all food to even to the neighbors' families, as we have just understand with the local authorities. And then we brought the number from 26 families up to 36 families that make 153 people who were supported by the fund, but it was only for 1 month. And then the fund which we have used, it was 56% of the total amount we received. Next. So there we should just, as we were in a lockdown situation, we should just also take the same methodology to use so as we can just reach our beneficiaries. That's why we sent direct money to the phones of beneficiaries, those who were in the remote area and those who were far from us, and then give to them around 40 USD so as they can buy the staff food, so as they can just feed themselves. And then those who were just near and they locate together, we tried just to reach them and buy them the food and distributed that food to them as a several number of the families. Next. So this is how we will organize during distribution. There it is just the beneficiaries who were waiting to receive the food which should be given to them. Next. Here we are distributing. There it is just the food which were composed by soap, by beans, by also by maize, corn maize, and also it was also composed by, there was also the salt. Next. Those are the pictures which is just when we were distributing. Next. So as I was saying, there in the distribution relief material were including maize flour, beans, salt, and even the soap, whereby we should just also just promote also hygiene and sanitation so as they can just be safe with property and cleanliness. Then the way forward, as we're still in lockdown here, but province to another province, our beneficiaries still do not have enough food, but we still, with a few money which we can use to give to them, and we will try to give to them the remaining. We will try to use the remaining fund so as we can distribute also another small food so as they can also keep struggling with this life. That's why we're still making advocacy to the other donors so as we may also get another food for the community. And then in the day coming also, we are just seeing how our people who are suffering with HIV/AIDS, how they can get also the health insurance. And thank you very much for the inclusive health and hope, whereby they have tried to give us the money whereby we'll pay the health insurance to those families. I thank you very much, and I think together and checking hand with each other, we will reach far, and we will also support more people as much as possible. Thank you, and thank you for hearing this presentation. Thank you very much.
Thank you, Bahati. It's good to have that report, and we're starting to get questions, so I'm going to move to that point. And if you